Hi there, you're welcome to my channel. Today we're going to be talking about cervical cancer, a disease that affects thousands of women worldwide. Cervical cancer is a serious but preventable health concern, and it is important to be informed and educated about it. In this video, I will cover the prevalence, causes, risk factors, symptoms, and treatment options for cervical cancer, as well as ways to prevent it. Do not forget that prevention is better than cure. Therefore, whether you're a woman, a man, an adolescent male or female, or a loved one of someone affected by cervical cancer, this video is just for you. So let's start the conversation and empower ourselves with knowledge. Stay tuned. Cervical cancer is the fourth most common cancer and the second commonest gynecological cancer in women worldwide. It is that cancer that affects the neck of the womb or the uterus. It is estimated that over 570 new cases are diagnosed each year, with more than 300,000 deaths. However, with early detection and proper treatment, cervical cancer is highly preventable and curable. So it is important to know the facts about cervical cancer so that we can take necessary actions to protect ourselves. But you may ask, what exactly causes cervical cancer? The main cause of this disease is a virus called human papillomavirus, which is spread through sexual contact. There are over 100 types of HPV, with around 40 types that can affect the genital area. This virus can be transmitted through the vaginal, oral, or anal intercourse, or even during deep kissing. In fact, nearly all cases of cervical cancer are caused by the HPV. It is important to know that this virus is extremely common, and most sexually active individuals will be infected with HPV at some point in their lives, but the majority of people will not develop cervical cancer. It is important to note, too, that the human papillomavirus can also cause genital warts and six other types of cancers, including oral, throat, vaginal, vulva, penile in men, and anal cancers. Who is at risk for cervical cancer, you may ask? Anyone can be at risk of contracting the human papillomavirus. In fact, we know that certain factors that may increase your risk include having multiple sexual partners, early age at first sexual intercourse, smoking, multiple childbirths, having a weak immune system, and not getting regular pap test or the HPV vaccination. Additionally, women who have HIV, who smoke, and who are exposed to the hormone diethylstilbestrol while in the womb also have an increased risk of cervical cancer. But how do you know if you have cervical cancer? We know that symptoms may not appear until the cancer is advanced, and this takes anywhere from 10 to 20 years from the initial exposure. But symptomatic women may have abnormal vaginal bleeding, postmenopausal bleeding, pelvic pain, and pain during intercourse. Other symptoms such as vaginal discharge, lower back pain, or leg swelling may also be present. However, it is important to note that many women with cervical cancer will not have any symptoms at all. So, what can you do to prevent cervical cancer? Well, the best way to prevent cervical cancer is to get vaccinated against the human papillomavirus and to get your regular pap test. It is important that adolescent girls and boys from the age of 9 years old should get vaccinated before they become sexually exposed. Older women up to age 26 can also get the vaccination. However, they must have a negative HPV result in order to do this. A pap test is a screening tool that can detect abnormal cells in the cervix before they become cancerous. Women with a consecutive negative result for 3 years can now present themselves for a pap smear once every 3 years. Additionally, practicing safe sex, not smoking, and maintaining a healthy diet and lifestyle may also help to reduce your risk of cervical cancer. And if you do have cancer, what may be your treatment options? Well, treatment options include surgery, radiation therapy, and chemotherapy. The treatment option will depend on the stage of your cancer. Surgery such as a hysterectomy or removal of lymph nodes may be done. Additionally, radiation therapy uses high energy waves to kill the cancer cells, while chemotherapy uses drugs to kill cancer cells. The types of treatment depends entirely on the stage of your cancer, your age, and your overall health. One very unique aspect of cervical cancer is the fact that it is one of those few types of cancers that can be detected and treated before it even becomes cancer. Precancerous cells or lesion on the cervix can be detected through a pap test or the HPV test and treated with the loop therapy or cryotherapy, as the case may be. This means that cervical cancer can be prevented before it even starts, which is not common for other types of cancers. Since we know for certain that cervical cancer is completely preventable, we encourage you to not let it snatch the lives of the women in your life. Encourage the women in your life, vis-a-vis your wife, girlfriend, sisters, mom, grandmom, aunts, and your friends, to get vaccinated and to get regular pap tests. Together, we can take action to prevent and treat cervical cancer. Additionally, it is important that we continue to raise awareness and educate others about cervical cancer, as this will help to reduce the number of deaths caused by this disease, especially in our region. If you have any questions or concerns about cervical cancer, please don't hesitate to consult with your doctor. Remember, knowledge is power. Like we said, cervical cancer is serious, but it is a preventable disease. Final words. Recently, I met a 17 years old girl in the hospital with full blown cervical cancer. Would you like to attempt to explain how this may have happened? Please put down your answers in the comment section. Consider following us and sharing this video with your family, friends, and all your loved ones. Thank you, and God bless.